Hi, I am Meg Martin, Executive Director of Interfaith Works, and you are tuning in to Lean In Olympia, our second episode. We are streaming every couple of weeks, tackling topics at the intersection of justice, humanity, and belief. So we are super happy that you're here, really excited for our guest today. Keylee, do you want to introduce yourself?
Sure. Hello, my name is Keylee Marineau, and I'm the Thurston County Homeless Prevention and Affordable Housing Coordinator at Thurston County Public Health. Glad to be here.
So today we're going to be talking about a couple of public health issues that are related to homelessness and specifically the COVID-19 pandemic that we are all still living through. And how the pandemic has affected our county's response, the regional response to addressing homelessness, and hopefully be able to get some of your questions. If you've got questions that come up, enter them into the comments and we'll figure out how to get them answered at the end. I also want to ask Keylee a little bit today about some information around opioid overdose. We have Overdose Awareness Day coming up on August 31st on Monday. And so we'll just check in really briefly about that. Also, we're going to have a video coming out in a little while about Interfaith Works' specific response to COVID-19 and everything that we've been doing since mid-March. So stay tuned for some of that as well.
Great.
Feel ready to jump into some conversation?
Let's do it.
Okay. So we have been, Interfaith Works has been dramatically affected by COVID-19, as you know. But starting in about mid-March, we transformed our shelter into 24-hour shelter services. Beginning of April, we opened a second location. We've been coordinating meals on site in a bigger way than we have before. We've been doing symptom screening, fever checks, all that stuff. So I want to talk, though, more broadly about how has COVID-19 affected the county's response to homelessness.
Sure, I'd be glad to. So at the beginning of 2020, we had just passed the 5-year plan, the Homeless Crisis Response Plan. And so in January, we were kind of looking at, okay, we have these strategies, and we're going to figure out how are we going to fund things and how are we going to meet the objectives of the 5-year plan, which we had spent the past year developing. And then in February, the Governor Inslee had issued an opportunity for local governments to the counties to work together with their largest cities to come up with a plan for how do we create new shelter beds by June. I believe the first round between April and June. No, by April, and then a second round by June. So just quickly scurry around and figure out how you're going to create new shelter beds.
And that was specifically to address the increase in visibility of unsheltered homelessness.
Right.
That's happening across the West Coast, but it is also very true for our community as well.
Absolutely.
Yeah.
So the governor had attempted to set aside an extra budget allocation of $300 million for homeless response out of the rainy day fund, which needed bipartisan support. And instead, he just found a way to issue some funds to each county to address homelessness. And so the ironic part about all of that was within the description of how you should respond was, is your county ready to respond to creating new shelter beds as if it were a natural disaster? Are you going to take it serious enough to act as if there's been a giant earthquake and then 2 weeks later COVID hit and we went into stay home? Well, not at that point, but COVID hit. And so suddenly we got to put our money where our ideas were anyway, our mouth were, one of those two things. So within 2 weeks of COVID becoming a real threat to our communities, and essential workers being the only ones coming into the office, the Department of Commerce said, here's here's $995,000 for your county to address homelessness during COVID-19 response.
Mm-hmm.
And so they had specific areas that we had to address, which was increased sheltering, maintain current sheltering, increase hygiene, access to hygiene, and then set aside some also for quarantine and isolation for individuals that could not safely quarantine in a home-like setting.
And the increased sheltering was both number of beds and 24/7 access, correct?
Yeah.
Okay.
24/7 access, all while also meeting the requirements around social distancing. So moving from shoving as many people into a shelter space as possible within fire code on the floor and mattresses to ensuring that all beds were 6 feet apart and maybe head to toe.
Mm-hmm.
So although we were able to respond as if it were a natural disaster, because it was and is, we had to decrease our shelter capacity, but Interfaith Works was able to stand up a new shelter in a week or so, which is truly something I have never seen in my few years of doing this work.
Fully because of how amazing our staff team is
Yeah.
and how nimble and adaptive and creative, and they were awesome.
Yeah,
Yeah.
absolutely. And so we met with all of the shelter providers to ensure that they had what they needed in order to basically maintain the capacity that they were operating at for cold weather, because we were in the middle of cold weather season, meeting those requirements around social distancing and going 24/7. So we did that with Community Youth Services, Family Support Center, and Interfaith Works.
Mm-hmm.
Our 3 main shelters. However, our other shelters in the community had to decrease their capacity. I have to cough.
Okay.
This is not COVID. Let me take a drink of water. Look at Meg.
We're social distanced in the office here.
We are. That's totally some weird dust particle in my throat. As you can see by the tears coming down my face. Okay. Meanwhile, back in homelessness response. One other thing that was cool was it didn't have anything to do about the county response, but St. Michael's Church has always offered single men or male identified folks 14 beds for the cold weather season, and due to COVID, they were able to expand to 30, which was really cool while maintaining social distancing. That was awesome to see that happen. But then we also created a contract with the city of Olympia to increase hygiene services, because as COVID unfolded, access to hygiene services rapidly decreased. The library shut down, which was an access point. The community care center shut down. Many of the public restrooms were just shut down. Then inner city transit shut down. And so we wanted to ensure that as many people in encampments and in downtown corridor had access to hygiene. So portable toilets, hand washing stations.
Can I just add, I think that was something that really has stuck with me this whole time, but just became so illuminated in that moment, was that it wasn't only the access to the actual services that was being limited for, at times, reasonable reasons, but it was that all of the public health messaging that was coming across from the governor, from the CDC, from the World Health Organization, for people who were going through that moment in time that have more than enough to have their basic needs met every day, they have stable housing, they have all the things, it was so confusing for everyone. But for the messaging to be stay safe, stay home, and then not have any kind of accessible other messaging for people who that wasn't an option for, it felt so scary to not know what to do, and then also simultaneously have the entire world around you shutting down without any type of messaging about how to stay safe. So for those of us working in the field, it was an additional layer, but then the biggest impact, as it always is, was to the folks who are unsheltered and living in congregate shelter areas or shelter programs in our area.
Right.
So.
Yeah, no, absolutely. I think when the stay home, stay safe, but then when the number, like social distancing, and then the number two recommendation for staying safe is to wash your hands frequently, and you live in an encampment and you don't have access to any way to wash your hands. It was glaring how unprepared in terms of a pandemic any jurisdiction across the United States was ready to address homeless people in an equitable way. It was just not prepared. And I think everyone did the best that they could, given the circumstances, but I think it really highlighted to me how unprepared we are to address houseless individuals' needs for any, like if there's an earthquake, if there was something, other than a pandemic, that would impact an entire community, we're unprepared.
And we had to really create our own playbook in a lot of ways. And what I think was really also a super beautiful thing during that moment in time was that everybody just mobilized. Like all the service providers were like, okay, this is happening. What do we do? We mobilized. And I think we were making jokes that we had like multiple meetings every day with the same kind of crew of people about very, maybe slightly different things. But we instituted really early on the symptom screening and fever check. And other organizations also got on board with that really quick. We coordinated what our methods were going to be for doing that so that we could have some kind of consistency from program to program. And everybody just like really cooperated with one another, shared ideas, shared strategies. It was really cool to see. And I guess I'm wondering if you would just talk a little bit about how you think that quick mobilization of response may have impacted the numbers that we're seeing of COVID positive cases in the homeless community.
Absolutely. I luckily chair or facilitate a lot of the meetings that happen on a weekly basis or monthly basis for my job. And so I was able to attend many of those meetings, if not all of those meetings. And there was at one point somebody from Public Health and Social Services who works with the treatment sales tax, Carrie Hennon, had stepped in to help me organize, or just to help support me in my job when I was at the incident management team at the Emergency Coordination Center. And she would sit in on these meetings and she would go, "You guys are like the most loving and compassionate and supportive people I have ever met."
Aww,
so I think
cool.
that it's a very galvanizing thing for agencies and individuals who are compassionate and care greatly about this work and the people that it impacts.
Yeah.
And I think absolutely, up until very recently, like 3 weeks ago or so, we haven't had a single case in the houseless population that has been COVID positive. And that's following the CCC closure.
Yeah.
Following so many services closing down where people did not have access to hygiene.
Yeah.
And there still wasn't an outbreak or even a single COVID positive case that we know of.
Right.
To be fair, at the very beginning, we had very little access to testing. You had to be extremely symptomatic, and the only place that a houseless individual could be tested was in Hawks Prairie, which was 4 miles away without a transit system.
Right.
So it could be that there were some positive cases within the houseless population, but not as far as we know.
And up until this point, the amount that we know of is it like a dozen, two dozen, less than that, right?
Less than a dozen. Less than a dozen as far as we know. I think there may be, and no, I've also been out of the IMT for a week, so there could be some that I just don't know about, but I would say under 10 for sure at this point.
And that's not, I mean, I don't have all the numbers in front of me right now, but that's not true about many other communities, particularly communities with high amounts of unsheltered houselessness. There were more significant outbreaks, higher numbers of death from that. And so I think that that's worth noting, that with the limited amount of resources, information, playbook that anyone had, we have really done a pretty good job of keeping people as safe as possible from
Yeah.
from this pandemic. So,
And I want to say that, we on our own came up with strategies of how to spend that initial $1 million. We as a community. So it wasn't just my office, the Office of Housing and Homeless Prevention, but it was the entire homeless crisis response system making informed choices about how are we going to do this? Like, what do we need to do to shore us up? And we focused on our system.
yeah,
The remaining was for quarantine and isolation, and we found other funds for that. But a lot of other counties focused their funds on finding a quarantine and isolation site
yeah,
as their priority.
yeah,
And so I really appreciate and celebrate the way that we did it.
yeah.
Yeah.
Will you talk a little bit about the quarantine and isolation process? Like, what does that, in an ideal situation, like, how would somebody who's houseless walk through the quarantine and isolation process? And, like, what is it? Where is it? That kind of thing.
Okay, so the idea being there needs to be a facility for people who do not have access to a home-like setting in which to isolate or quarantine, depending on the situation. And so,
And this would be for awaiting test results or for a positive test, correct? Okay.
right. So if you are tested from a public health perspective, it's presumed that you're positive. And so you need to isolate after you get your test. And then if you have been exposed to someone who you know is COVID positive, you need to quarantine yourself for, it was up until today, 2 weeks. But I just noticed the CDC has reduced that 14-day, and I didn't actually read the article, so I don't know how long, but it's no longer 14, but it was 14 days. And then if you're positive until 10 days past your first symptom onset, you would have to stay isolated. So the public health officer at the time, Dr. Yu, and the director of public health, Shelley Slaughter, was of the opinion that if there's a person in the houseless community or someone who was in an encampment and they were tested, if they had a place where they could isolate and that was their tent, that was okay. But if an individual who wanted to get testing and didn't have a safe place to stay, they would come to a testing event, which didn't start happening until the end of May, and get tested another way, and then from that point would be transported to our local quarantine and isolation facility, which is a hotel in near downtown Olympia. It's only one floor of a hotel, and it's staffed 24/7 for safety. And so a person would be assigned a hotel room, and then they would get 3 meals a day. We do all that we can to make them as comfortable as possible, so that to encourage them to stay, to keep themselves safe, and to reduce the risk of infection out in the community.
And what I think was interesting about that process was that I think because our local county health department is really collaborative with service providers, that means that public health responses get coordinated with the homeless service response in a pretty effective way, I would say. I mean, I don't know exactly how other communities do it, but so from the very beginning, quarantine and isolation was routed through the coordinated entry hotline number, which is a phone number that anyone who is experiencing homelessness or at risk of experiencing homelessness can call this 1-800 number and get routed to one of the 3 coordinated entry providers that we have in our county. So Community Youth Services for youth and young adults under the age of 24, Family Support Center for families with dependent children, and Community Action Council for single adults or couples without dependent children. And so there is a quarantine and isolation option through the hotline that connects with county health and can get people. So ideally, somebody would get a test at one of those centers and could coordinate through the homeless system. So what's I think is cool about that is that the hope is that when they get to quarantine and isolation, there's already a thread for additional services that they might be qualified for, that they can get routed into for when their test results come back, right? So they could potentially be referred to shelter or housing or some other kind of service.
Yes. Ideally, and I'm making faces because, yes, ideally. I mean, I was granted the privilege of being the quarantine and isolation lead for some time, to get quarantine and isolation up and running and make it operative. And so I think that it was definitely a case of building the plane while flying.
Yeah.
And so just getting it operational was such a feat.
Yeah.
And then making food happen, and clothing donations, and transportation, and communication, and all of that was such a big deal that I think there is so much opportunity for there to be complete linkages. Like, you have nothing else to do. Like, besides watch TV in your hotel room, and it's a good opportunity to get connected. And I think that hopefully that will improve with time.
Yeah, I keep like making little jokes that I'm like, the next pandemic we're gonna be like super ready for, because of all of this foundation and like groundwork that's been laid.
Mm-hmm.
Yeah.
Yeah.
Well, what else is like coming to mind? I mean, do you know much about, like, I feel like another kind of disconnect that I've seen is the way that COVID-19 is being handled on a national level, and like and then how that compares to the local response. Like, is there overlap? Is it just completely separate? Like, I don't know. Do you have any thoughts about that?
I think that my thought would be that local jurisdictions have a lot of authority to make decisions that are hopefully in the best interest of their local jurisdiction. And regardless of or alongside any kind of federal response. Mm-hmm. And so I would say that the only thing I noticed from the federal response that's been helpful are the release of funds.
Yeah.
So taking, the CARES Act, there's an increase of the Emergency Solutions Grant dollars, significant amount. The Eviction Prevention Rental Assistance Program, which is part of another CARES Act kind of. So the federal allotment of funds has been the only thing that I think has really been in sync with what we want to do in terms of responding. Yeah. But I think that each public health officer has their own way of considering how they want to move forward with response, and we've had two. So we started this COVID-19 with Dr. Yu as a public health officer, and now we have Dr. Abdulmalik, and they're very complementary, but they also have their own way of and they have different decisions to make, because at the beginning everything kept changing every day, and now things continue to change every day, but with different flavors, because we're talking about returning to school, which is not something that Dr. Yu was. Those were not questions Dr. Yu was looking at, so it's been really interesting to watch the public health officers kind of wrestle with this. And I just spoke with Dr. Abdulmalik last week, or this week actually, or was it? It was last week. Around
what is time?
Yeah, what is time? I don't know. About like, okay, so what are the protocols? Ensuring that the protocols for local hospitals for releasing or discharging individuals who are houseless, are they in sync? Are they actually in alignment with the county's response in general? So I really appreciate Dr. Abdulmalik taking concerted interest in ensuring that houseless individuals who are being discharged who are not COVID positive during this pandemic are getting where they need to go and are in sync and are not causing unintentional harm. So yeah.
Keylee, can you talk a little bit? You mentioned the eviction prevention, and I know that that's a big question on a lot of people's minds. We have this eviction moratorium that's in place. I think it just got extended through October.
I think October 15th.
Okay, October 15th. And so, I am like, what's going to happen, right? Because it's not like rent is being canceled for all of those folks, right? It's just kind of piling up. And so I know that there's a ton of concern about Thurston County. I've heard numbers from the Economic Development Council that there's over 30,000 rent-burdened families in Thurston County, meaning that they pay more than 30% of their income to rent on any given month. And so I'm like, what are we doing locally to address that, and what kind of specific concerns come up when thinking about the eviction moratorium being lifted.
So Thurston County received $3.1 million for this program. And this is a program that every community in Washington State is implementing right now. So we're basically building this program from the ground up in a matter of weeks. And so what we're doing, there are very specific guidelines that come out of the Department of Commerce. And so the grant, even though it's $3.1 million, on the one hand, we need to spend it as fast as possible. On the other hand, like, that's never enough money.
Yeah.
Because the faster we spend it, the bigger case we can make for adding more money to it. And so there are eligibility requirements, and I don't remember them all. They're all on the CAC website. You should check it out.
Community Action Council.
ERAP, Community Action Council of Thurston, Mason, and Lewis. So 50% area median income, and then there's a chart that they have online so you can see if your family is eligible, and having missed at least 1 month of rent since March of 2020. And
so they can pay back rent
Mhm.
till March.
Yeah.
Okay.
And they can pay forward if
Yeah.
that's more helpful. So the limitations are, it's only 3 months.
Right.
So if you have been rent burdened and you haven't been able to pay rent since March, and now it's August, and you're also wondering how you're going to pay rent going forward, you have to make a choice of where those dollars are going to land, because that an individual can only apply one time. And so if you have 3 months worth of rent, how are you going to use it? I mean, of course, it's really, really helpful, but there are questions in my mind of what happens after the 3 months.
Yeah.
And then what happens, moving forward. Let's say somebody was able to receive the dollars and get their rents paid for 3 months, and maybe that's fine. But will landlords be willing to work with them and not raise the rent after that because of their lost revenue?
Right.
Will they evict after that? Because I'm sure the landlords are experiencing a lot of financial stress and, around all of this. So it's really delicate. I know in King County, they have added 2 policy level decisions for landlords that they are not able to evict anyone until March of 2021.
Mm.
So if they accept the ERAP dollars up in King County, they're agreeing not to evict anyone except for good cause or just cause until that period of time.
And I think we are trying to do something similar to that locally, right? To work with landlords to try to make it individualized plans for people. So
Yeah.
I think it's important to note too that there's so many different things to talk about with the pandemic and houselessness and everything, but one thread that is woven throughout is racial inequality, and how Black, Indigenous, Brown families and individuals are at significantly higher disproportionality to experiencing homelessness, and also for risk of losing their housing during this eviction moratorium. So I think that I know that with the Commerce Grant dollars, they were meant to be, it's required that they are targeted to families and individuals who would be most impacted by the pandemic, which is families and individuals of color. So
Yes, and pretty much any contract around housing and homelessness coming out of Commerce right now has a focus at the top, like housing first, but before housing first, that was racially equitable response to ensure that there's racial equity in prioritization into housing programs. Racial equity is taken into consideration, or is the first priority in terms of accessing the ERAP dollars.
yeah,
We are also required to ensure that 5% of that $3.1 million is going directly into the hands of by and for agencies, which means agencies that are run by and serving the same population. So CLO is one of the agencies within our county. That's one of those by and for agencies that can help people get access to those dollars. Which also, we've got a new diversion program, so another way that people can get access to housing right now. Family Support Center of South Sound was awarded a diversion pilot program grant in the middle of all this to ensure that folks of color, our BIPOC community, Black, Indigenous people of color, that are experiencing houselessness or on the verge of houselessness are across the county are being offered diversion dollars to stay out of the homeless crisis response system.
Yeah.
I mean, that's the only purpose of that grant. So,
Yeah. And we've been working locally for the last few years to really tie in race equity into housing prioritization, into shelters, permanent supportive housing programs, rapid rehousing programs, and so there's a lot more work to do, but we can't have this conversation without really centering the fact that race equity is so key to any type of solution or strategy that is going to be effective.
right. And I think that it, in a pandemic, as if there were other pandemics that we're comparing them to. But this pandemic there have been so many excellent resources, webinars, data all over the place, or lack of data demonstrating that communities of color are experiencing higher levels of death because of COVID-19. So if you've got higher levels of death, higher possibility or probability of homelessness or living in poverty, like, we can't not have these conversations. But how do you do them responsibly when predominantly the people in policy-making decision positions are white?
Yeah.
I'm in a position of power. I'm a white person. I have influence, and so how are we having meaningful conversations? We started that one a long time ago. There's another conversation we just started having about anti-racist housing policies, because, having a requirement that the homeless crisis response system be making it a number one priority to be addressing the needs of communities of color in particular.
Mm-hmm.
But there aren't any policies that can support that, or there are very few policies, or we don't even know how to write the policies to ensure that happens, or have any kind of checks and balances. I don't want it to be meaningless. I don't want to just have conversations, even if they're great, with great people.
Yeah, totally.
Without some kind of policy stuff happening underneath it to make it meaningful.
And I think that call from many leaders in our community who are people of color, who've been doing this work for such a long time, I think that call is louder than ever, and I'm hopeful that white leaders like myself, like yourself, in the community are gonna listen and take those actions. So, well, I do want to talk a little bit just about Overdose Awareness Day too. So, do you have anything else about COVID-19 that's kind of lingering in your mind that you want to mention to the group?
And COVID-19 please.
Yeah. Well, I think, just making sure that recognizing the fact that compassion fatigue is really real, the isolation, working from home, the lack of access to information and to the things that we need. I mean, this is a very exhausting time for everyone, and it's a more exhausting time for some people than others, and I just have been feeling compassion for myself, compassion for everyone around me is helping to get me through those darker moments.
Right.
So
I think I would just say that, thank you for saying that, if you're a person who's in leadership and you run an agency, or you want to run a program, or you are working, something that you're doing is touching the homeless crisis response system, that impacts on the houseless population have been tremendous. And I know there's great concern. We have a significant increase in outreach, which is great. And all of the outreach workers are really concerned about accidentally bringing an infection into an encampment. So just that constant vigilance and hyper arousal around fear of harming the system.
True about shelter staff too.
Yeah, and shelter staff. And then, having shelter staff, people in my family that work in shelter, they're so concerned about keeping excellent hygiene, but they live in a house full of people, so it's just like this constant state of stress and tension, and that to be gentle with yourself, and it's appropriate to lying on the couch for a couple days is okay, or more, and to be really thoughtful about how you support your staff. And there's some good stuff out there to make that happen, but be really mindful of your staff. Like, burnout is always real, but burnout right now is
especially real.
times 10.
Yeah.
Yeah.
So the other part of that, I mean, I think that's really true, is that risk of increased use of substances during a time like what we're in is really common, especially when a lot of people's recovery networks have been gone. They're gone, so many people rely on getting together to have really active recovery programs, and those are not really happening right now. And if they are happening, they maybe are happening in ways that aren't as effective. And we talk a lot about the opposite of addiction not being sobriety necessarily, but the opposite of addiction is connection and a sense of self-worth, and a sense of belonging in a meaningful community. And all of those things are on hold in a lot of ways, right? And so Monday, August 31st is International Overdose Awareness Day, and this is a observed holiday for Interfaith Works. We have it as just something that, because of the people that we are as individuals, who have, many of us, gone through recovery processes, are going through, there's never a start or a finish. And because of who we prioritize for our shelter, substance use and recovery is like a big topic for us. And so it feels really important to always honor those who have made it through, and those who have not, and to honor their lives and their struggle. And so another public health emergency declared, correct, is the opioid emergency on the county level. And so I just wanted to talk really briefly about overdose and kind of what we've seen this year so far. Do we have much information about how the pandemic has affected it?
Yeah, so according to Marineau Garrow, who's our senior epidemiologist at Public Health, getting data from her, so far in 2020 we've had 12 overdoses resulting in death, and 80 reversals. And reversals that's not an accurate accounting of reversals, because different jurisdictions count reversals in different ways, and that data doesn't necessarily always intersect and inform each other. And then also is very, very underreported, as you know, very well. I think...
And when you say reversals, just for folks who might not know, Keylee's talking about opioid overdose reversals with a prescription, non-narcotic prescription drug called naloxone or Narcan. And it can be administered either nasally, like Flonase, or intramuscularly, which is like an injection. And Narcan distribution has been something that's been extremely meaningful to myself in my own life, but also through Interfaith Works. And there's been a huge increase of Narcan distribution and a big push from statewide Department of Health to make it more accessible. And get more people trained. And before the community care center closed, we were doing regular community trainings to businesses, employees, public libraries, all of those kind of places to really get the word out about it. I believe it was in 2018, it might have been 2017, that the Olympia Police Department all started carrying naloxone, which was something that we had been trying to get that to happen for many years. And so the reversal information is really important, because those are all overdoses that otherwise would have been counted as fatal overdoses had someone not intervened and been prepared and trained to intervene.
Correct. So I think that the ways that, if you're going to marry the pandemic and this conversation, there's two things that come to my mind, and that 12 by August is actually lower
Yeah.
than it's been in previous years, and I think that has a lot to do with what you just said. Increase access to Narcan and naloxone across the county through various means. And then anecdotally, there was a reversal in Olympia a couple weeks ago, and the person who had administered Narcan was a person who lives in his van. And in just having a brief conversation with him, you know, he had identified himself as being someone that is kind of the community. He collects the needles that have been used in his community, but he never makes it down to syringe services because of mobility issues, because of timing, because of not really knowing where it is, not remembering the hours, and not knowing what to do to get Narcan, or not knowing, like, just having barrier after barrier around that person, individual, just one person. I mean, it's only about 1.5 miles to where the syringe services are. And so we were able to have a conversation and figure out, one, how to get collect those needles that he'd been collecting for his community, and also ensure that he had Narcan to distribute again, because he had used the Narcan that he had on him. And so just like little stories like that, where I'm anecdotally hearing in downtown Olympia through my work with the opioid response coordinator, who was connected to the quarantine and isolation for a while, just anecdotally multiple reversals that absolutely are not being reported to the police or emergency services. They're taking care of it on their own. And so we've had 2 very young people, pass away in the last month from it. So it's still huge, and that Narcan out in the community right now is extremely important.
And we also know with the increase of synthetic opioids that are extremely strong, like hundreds and hundreds of times stronger than traditional, like Oxycontins or other opioids, that also stimulants, so drugs like methamphetamines, cocaine, are being tainted, laced, whatever, with synthetic opioids as well. And so it used to be that when we would be doing trainings and education in the community, it was always focused around opioid users only, which can span the whole lifespan, right? It's it's a teenager who has a surgery to an elder who has a surgery, right? Like, so many people across the lifespan are at risk of opioid overdose. But now we also have to work with people who use all kinds of drugs because we're seeing stimulants being the cause of fatal overdose at a higher rate than we've been used to in the past. So I just try to take every opportunity I can to talk about this, because it impacts us all one way or another. And we did get one question on the live, which is very exciting, from Quixote Communities, who we love and work with all the time. So what are things that people can do every day to help? And I bet that this is about both COVID and the opioid epidemic, but
we can answer both.
Yes.
Well, I would say there isn't really a centralized location for donations. I mean, there's not one hub where the donations have been dispersed to the entire homeless crisis response system. So calling each individual agency, or let's say you love families, or you love youth, or you really care about interfaith works, just calling and getting a sense of what are the things that are needed. And on websites of all those agencies, almost they have a list of things that they're looking for in terms of donations. I know that a lot of agencies are not looking for volunteers necessarily right now. Some of them are, like Build a Bus Home is looking for volunteers, by the way, for their hygiene trailer. But financial support and appealing to each individual's agency's needs, and then also in your own communities and in your family circles, or in the people that you interact with, when there's a negative comment made about houseless individuals, to spend some time finding talking points to educate the people around you, to decrease stigma. There's a lot of harassment that actually occurs that a lot of people are not aware of houseless individuals by angry folks that just don't understand, and because stigma is such a big deal. So please come up with some clever talking points for to destigmatize houseless individuals.
And if that seems like a topic that would be cool for us to cover on this show, we've done a ton of work on all that, and so maybe we could help the community have those hard conversations, because it is really difficult. I know that there's a lot like Goodwill and some of the other places that often people will bring their clothes and all of that too, are not taking donations at this time. So again, just like Keylee said, like checking in with individual organizations. I will say that Interfaith Works in particular, has been working with other organizations to get things out to unsheltered people in encampments. So like we've had a lot of folks sew masks for us, which is amazing, because the N95 mask and surgical masks were in such short supply, still are. And so we're really relying on cloth masks, not only for our staff, but also for our guests that stay with us. And we just worked with somebody who's living in an encampment in East Olympia to make sure that they had 3 bagfuls of cloth masks. And so there's a lot of mutual aid happening right now, not only among service providers, but also with folks on the street too. So it's really likely that if you do bring belongings or donations like that to a place, that it will get to where it needs to go. So
I think also cold weather season is coming, and the pandemic is not over, and so we haven't identified yet a single adult shelter that can expand to increase capacity for houseless individuals during cold weather. And so we're increasing our shelter in place to include more sturdy survival items, such as tents and stuff like that. So Partners in Prevention and Education are contracted with the county to be kind of accumulating that stuff. So check out their website.
yeah. Well, it has just been a joy talking to you. I feel like we could talk all day,
Yeah.
but I know that people have their lives to get onto. Our next show, we are going to be talking about our upcoming Peace Day Festival, and that is going to be on Tuesday, September 15th. We're going to have some of the folks who will be speaking at the Peace Day Festival here for that. We're super, super excited. Peace Day is the 21st of September at 5 p.m., and it's an international recognition event that we're going to be doing with some really amazing local leaders who are doing awesome, awesome, awesome work. And if you are looking for more ways to get involved with Interfaith Works specifically, check out our new spiffy website that we're really proud of, interfaith-works.org. And we just thank you so much for tuning in to Lean In Olympia, episode 2. Thank you, Keylee, for being here.
Thank you.
And we will see you next time.
Okay.